Which of the following medications is most appropriate initial treatment for this patient? 45-year-old woman is admitted to the ICU following a severe motor vehicle accident on her 5th day of hospital stay. She develops melena and I really can't say that. Hematemesis.
Yeah,
Hematemesis.
hematemesis.
Hematemesis. Thank you. The physician suspects a stress-related gastric ulcer. Okay, which of the following medications most appropriate initial treatment? PPI is always a good choice here. Antacids are also a decent choice because they're going to coat. And she's having the melena, so she means she has a bleed, and they think it's from a stress-related gastric ulcer. Also, they do like the H2 receptor antagonist. So I'm like definitely not misoprostol, definitely not sucralfate or sucralfate. EPI. I remember they were teaching us in GI, like there's an order to these. It might be PPI first here, but it seems like if the stress-related gastric ulcer, it's that mucosa is like torn away, and maybe we're going to want to stop or inhibit a little acid production to make it allow it to heal as opposed to coating it. Yeah, I don't know that I can't remember the order of how these are supposed to go. All three of these are like decent answers. I just don't know what the
Sure.
best initial treatment would be. It seems like in the hospital we put a lot of people on PPI, so I would guess PPI there.
Yeah, PPI is
Yeah.
gonna probably be your best here. Okay.
Okay.
It just works the best, right? It's the strongest. You already have a tear, so
Okay.
you wanna give you the strongest kind of medication right now, and PPI is gonna be the best here. Antacids, right? It neutralizes, it temporizes,
Hmm.
but it's just not strong enough. And
Like the
H,
bismuth, right? Like they always talk about that.
yep.
Like, oh, bismuth is just going to
Well,
coat. It's just going to
yeah,
coat the
or
stomach.
peptopismol, right? Is an
Hmm.
yeah, or what is it called? Tums. Tums is an
Tums or something like
antacid.
that. Okay.
Yeah. So that's not going to really do too much here as much, right? And then H2 receptors, right? Like famotidine, right? That's not going to
Hmm.
work as well. PPIs are way better.
Okay.
Misoprostol, right? It can also actually help, right? By increasing mucus and bicarb helps
Oh, that
coat
makes
a little
sense. I
bit.
didn't think about that.
Yeah,
Okay.
but like I said, not going to be your first line. Sucralfate is also right a protective barrier too, right? But like I said, PPIs here is going to be the strongest that is going to help you here. So you want to do
Okay.
a PPI, and then the other answers aren't bad, right? And no one's ever going to fault you for adding things, right? By any means, right? But definitely for sure, you want to start with PPI. It's going to be the strongest.
Okay.